Well, it's time for our weekly visit with Dr. Zorba Paster, and we'll be taking your calls in the next segment.
We mentioned earlier that more children and teens are being diagnosed with COVID than ever before. A new study in the Lancet Medical Journal looked into this. Dr. Zorba Paster joining us from his clinic in Oregon with more. Doctor, good to see you.
Hi, Zorba.
Good to see you guys.
Tell us about this Lancet study.
Well, the Lancet study has shown that there are more kids, more teens that are actually getting COVID that were previously realized. And once again, we don't know exactly what the long-term effects are, but we do know that some people have long COVID. And so it's really problematic because they may be asymptomatic now, but it may cause problems later on that we just don't know about because remember, this is a virus in evolution. And the other thing the study showed is that even if you have COVID, there are a certain percentage of people that can get COVID again. So that's why the recommendation is to get immunized even if you have it. And the studies really come out of the UK, out of England, and out of Denmark, where they're testing healthcare workers and finding and a number of people and finding out that it's roughly somewhere between 7 and 15% of the people who have had COVID and are in high-risk situations get COVID a second time. So once again, even though you have it, and I have people who say, look, I had COVID, should I get immunized? And the answer is yes, immunize, get both shots in the booster, or if you're getting the J&J shot, one shot and done.
Let's talk about the Johnson & Johnson vaccine and the news this week that it's been paused in the U.S. and it's generated some confusion, especially for people who've already received the shot. What's your advice?
Well, the issue is it's one form of a blood clot. Now, blood clots are common. DVTs, or deep vein thrombosis, is very common. And the question is this blood clot, or it's actually a variation of the most common one, is it actually caused by this? So they're looking back at the data. They want to see whether or not it's there. And then if it's there, they want to see what the numbers are. So if it's 1 out of 1 million, it's very different than if it's 1 out of 1,000. It's nowhere near there. If it's real, it's 1 out of 1 million, and they want to look back at the data. And I commend the CDC and the FDA for doing this. They're not just sweeping it under the rug. They want to see what is the data. Is it coincidental, or is it actually cause and effect? The recommendation is anyone who has pain in their legs, is worried that they might have something that is abnormal, and got the J&J vaccine, to talk to their doctor about it. And once again, blood clots in the legs are very, very common. I would guess most of your listeners out there have either had a deep vein thrombosis or know someone who had it. And this is a variation of this. It's a common problem, but slightly different from the usual one.
No reason not to get the vaccine, though.
Oh, not at all. Remember, the risk of COVID is death. The risk of a DVT is you've got a deep vein thrombosis and you have to get a treatment in the hospital, but it's nowhere near the risk of COVID. And I think that's the important take home, because people get worried about this. They should worry about COVID. Oh, more than 500,000 people have died from it. That's the elephant in the room.
All right, it's now time to call in if you have a question for Dr. Paster.
If you have a question, the number to call is 270-9933. Call right now and we'll get to your calls right after this.